again, that in the triple negative story, we have known for a long time that in the presence of TILs in the biopsy is important. Presence of TILs in the excision specimen is important. But the question had always remained as to what is the role, if any, of TILs in residual disease in the post-neoadjuvant setting. So the EA1131 trial consisted of 410 patients that were subtyped by intrinsic subtype classification using the PAM50 assay. And patients were then treated with platinum versus capecitabine for the residual disease. And the question basically was, would platinum be superior for patients with basal-like cancer? So we basically had 342 patients on whom we had histology slides and consent for research, and we analyzed the presence of TILs in this patient population. And what we basically saw, again, that TILs were much more infrequent than what we saw in primary disease in the residual tumor. And then B, those low TILs were still prognostic of a likelihood of better response, or we had IDFS, that is invasive disease-free survival outcomes, and these patients had a much better survival. Now, the second question was about the intrinsic subtypes, and what we found was a vast majority of these patients were basically basal-like with very low TILs. The incidence of high TILs in these patients was less than 10%. And so we combined the patient groups of basal with low TILs with all other groups within that particular study. And then we showed that basal with low TILs was associated with with a more aggressive disease, that is worse outcome as compared to all other patients. So this was true for IDFS. However, in the overall survival analysis, it did not remain as an independent factor for prognosis.